Founded in 1950, Doctors with Africa Cuamm is an international NGO working for health system strengthening in sub-Saharan Africa, with the aim to protect and improve the well-being and health of vulnerable communities. Working with local professionals and institutions, Cuamm is active in 8 countries: Angola, Ethiopia, Mozambique, Sierra Leone, South Sudan, Tanzania, Central African Republic, Uganda. Priority areas are maternal, newborn, child and adolescent health, nutrition, infectious diseases and non-communicable diseases. The strength of Cuamm in humanitarian response is its deep knowledge of local health systems and the rooted relationship with local stakeholders. This ensures immediate action and effectiveness. In South Sudan, despite current instability and conflicts, is strengthening local health systems, ensuring adequate assistance at all levels, from communities to primary health care to hospitals. In Central African Republic, is responding to children's health needs, supporting the only paediatric hospital in the country, in Bangui. In Sierra Leone, Doctors with Africa Cuamm, in partnership with the Ministry of Health, has developed the first national emergency medical service. In EPIDEMICS, Cuamm team was one of the first to intervene during the Ebola outbreak in West Africa, setting up a triage point and holding centre for the prompt identification and management of cases, while implementing Ebola control programme managed to keep running routine health services, including those for mothers and children. South Sudan Ministry of Health and its partners included Cuamm in the South Sudan Ebola Preparedness and Response Plan. Cuamm is also acquainted to intervene in case of seasonal epidemics, as that of cholera in Mozambique, Angola or South Sudan, or measles in South Sudan, acting on the prevention, identification and treatment side. During natural disasters, has guaranteed the prompt resumption of health services, like in the case of Idai cyclone in Mozambique, the drought in Angola and famine emergency in South Sudan. Cuamm also works with refugees, migrants and the local hosting communities. In South Sudan, has been involved in the Internal Displaced Persons Tracking Programme. In Gambela, Ethiopia and West Nile, Uganda, has been part of the response to South Sudanese refugees. Cuamm is convinced that working on comprehensive health system strengthening is functional to increase its resilience. Better health systems will be able to timely prevent, identify, contain and manage future crises. Based on this assumption, Cuamm interventions in humanitarian settings promote local ownership and partnership and include capacity building of local professionals and institutions. Doctors with Africa Cuamm, since 1950 for the right to health.